every mental illness has something to do with dopamine, and a lot of physical illnesses. Think of Parkinson's, Alzheimer's is indirectly related, Huntington's chorea, Tourette's, restless legs, stuttering. All of these things are dopamine related. And, we have to put that together. We also know that any chemical, like a stimulant, that that surges dopamine, like amphetamine, or the medications we use to treat ADHD, which we have to be very cautious with. Any medication that can surge dopamine can lead to psychosis.
Hello, everyone. Welcome to 45 Forward on Bold Brave TV. I'm your host, Ron Roel. On today's show, we're going to talk about a subject that's carried a lot of stigma over the years, mental illness. Now, in the last few years, there seems to be a growing awareness of mental health issues among both younger and older people across the country, in part, I believe, spurred by the experience we all had with the pandemic, sort of the isolation and the disruption we all experienced. Now, we know, in fact, that the healthcare crisis in the country is such today that 1 in 5 adults experience a mental illness and 1 in 20 adults experience serious mental illness. And that's according to the National Alliance on Mental Illness. Certainly, we're more willing to talk about mental illness, but it's still a difficult conversation. So I'm gratified today to have the opportunity to have on my show Dr. Stephen Lesk. Dr. Lesk is a practicing psychiatrist for many decades, and he'll be talking about his book, Footprints of Schizophrenia, The Evolutionary Roots of Mental Illness. It's a fascinating book that offers a perspective you probably wouldn't expect. He uses his determination to find an answer to the origins and persistence of this disease by integrating insights from psychiatry, but also neuroscience, anthropology, even evolutionary biology. He's not only a psychiatrist, he's an innovative theorist. So there's a lot to talk about, and without further ado, let's meet our guest, Dr. Stephen Lesk. Dr. Lesk, welcome to the show.
Hi, thank you very much. I look forward to having a chance to explain my theories and win over some converts, I hope.
Great, great. And of course, the show is 45 forward, but it affects people of all ages. First, how many people in America today have schizophrenia, and why is it so important in your view?
Well, I could say that schizophrenia is the big kahuna of mental illnesses. It affects 1% of the population worldwide. So in this country alone, it's about 3.5 million. And if you think of that and all their families and caregivers, it's a massive number of people involved with this disease and loss of productivity and, of course, emotional pain and difficulties for them and their family. So it's a huge problem, but it's stigmatized and no one talks about it. 1 in 100, everyone either has a relative or knows someone who has a relative with schizophrenia. But do you see it on television? Do you see it in the news ever? Never. It's so stigmatized, and it's stigmatized because we don't understand it properly. And that's what I'm trying to change.
Well, I'm glad you are, because as you just pointed out, you think, well, this is sort of a marginal issue, but as you point out, you go to any sort of social gathering or any conversation with people, and you start talking about mental health issues and schizophrenia or other kinds of mental health problems, and invariably the conversation goes, "Yeah, I have someone in my family, or I have a friend." So it basically does affect everybody, and it's really a mainstream problem. So I'm glad you have this book. And before we dive into the book, talk a little bit more about just, I think a lot of people just have a very superficial understanding of and sort of stereotypical view of schizophrenia. So talk a little bit about, what we know about it. I know there's not a lot we don't know about it, but what do we know about it, and describe a little bit about what the effects are.
Okay, well, just a quick comment is that the book is not just about schizophrenia. It's about all mental illness. But imagine yourself, you're going along through high school, you have some friends, you have a family, reasonable family, you're doing okay. And maybe around the end of high school, the start of college, people start treating you differently. They look at you oddly. They act like you're saying weird things. They may say, I'm worried about you. Then people start noticing you're withdrawing from others. You're not taking much care of your appearance. You seem uninterested in people. And then you may start saying strange things like, the government has poisoned all the peanut butter, or,
Mhm.
someone's following me, or the government has hacked into my computer. And then gradually it becomes pretty clear that there's been a change in your thinking. You don't realize it, but everyone else can see it. So you find yourself as a schizophrenic in the situation of everyone's treating me differently, but I'm the same person I was, a year ago. Clearly that's not true. So then hopefully you're brought to a psychiatrist or other mental health professional to make the diagnosis, which isn't that difficult to make,
Mhm.
but certainly over time it clarifies uh, in that window between, let's say, 16 and 25. If you're beyond 25, you're probably pretty safe that you're not going to get it, although there are exceptions. So what people are noticing is that your thought process has changed, and you
Mhm.
think strangely, you entertain delusional ideas, you may talk about voices coming out of the vents, you feel the government is after you, and things like that. And you withdraw from people, and like I said, you stop taking care of your appearance, and you functionality always diminishes once you have a diagnosis of schizophrenia. Now, there are some high functioning schizophrenics,
Mhm.
doctors, lawyers, you name it. But for the most part, your functioning is going to decrease once you get that diagnosis.
I do find and of course the show is 45 forward, but for a lot of people who are in their 40s and 50s and older, you have children, who are dealing with this issue. So I think it does affect every family in many ways. So those are some of the symptoms. Now I know one of the issues and what you deal with not only schizophrenia but mental health in general, as you point out, is looking at some of the causes, and it's difficult to ascertain. And at one point you said we don't know anything. I mean, really, I mean, we're at the very beginning of our understanding in a lot of these ways. And as I've been reading about it, I've been learning a lot, and not surprisingly, the more I learn about it, the more I realize I don't know very much at all. So, but talk about some of the causes, and I know that a lot of it has to do with the dopamine. But to talk a little bit about that, about we know about what the triggers are and the complexity of the triggers.
Well, some of the things I say may surprise you or shock you, but my theory says this, that mental illness is entirely due to the evolutionary moment that we find ourselves in. So, what does
Hmm.
that mean? That means that 50,000 years ago, there was no mental illness. 20,000 years in the future, there will be no mental illness. But because we're in this very unique evolutionary moment, we are seeing mental illness in up to 20% of the population. And, I can go into detail on that, but that is a fact that has many implications and which psychiatry is totally reluctant to even entertain, let alone, agree with. They won't even look at this possibility. And that, I think, is a shame. A geneticist named Dobzhansky once said that nothing in biology makes sense except in the light of evolution. If you
Hmm.
can look at where something came from, your understanding of it multiplies infinitely. And we have to do that in order to know what we're treating and where we're going. I've said that psychiatry is in the dark ages, and a lot of psychiatrists are dissatisfied with the profession. I was just a couple of weeks ago giving a poster session at the Minnesota Psychiatric Society meeting, and a lot of young psychiatrists came up to my poster and said, Wow, this is fascinating. Why don't we ever hear about this? Because no one will consider it. No one is willing to think along these lines. This is, a situation that's not obvious. I mean, we're all in the midst of evolution, but we don't see it. You don't look around every day and say, oh, look, we're evolving. On the other hand, if you think back to just in my lifetime, when I grew up, there were no cell phones, there were no computers. TV was this weird box with a flickering screen in the middle. Now everyone is on a smartphone. TVs are this, sharp colored flat screens that are all
Mhm.
we're progressing at a maximally rapid pace, but not everyone has kept up on it. Now, regards to dopamine, we have to
Mhm.
discuss language, and
Right.
we can do that now if you want.
Yeah, well, I just go in a little bit. I mean, I know that I guess that a lot of the theory is about, the causes are related to either excessive or deficiencies of dopamine in the brain and how that affects you in terms of, symptoms. So, but I don't think people really understand the relationship to language. But talk about that first, just the issue of dopamine, and then we could get into, well, what does that got to do with language and our evolution?
Well, every mental illness, this is according to my theory, every single mental illness and some physical have to do with the desuppression of dopamine, which means that as we, advance through adolescence, we learn to suppress dopamine in certain tracts of the brain that we never could before, the mesolimbic, mesocortical tracts. We do suppress dopamine in the nigrostriatal tract, which is a motor tract. Kids learn to do that. They learn to have coordinated movement. But with language, we learn to suppress dopamine in those other tracks. Now, when schizophrenics break down, there is a huge rush or desuppression of dopamine in those tracts. And that is exactly what we target with our medications. But no one is talking about why is this happening in the first place? And I'm trying to explain it and connect it to language. So every mental illness has something to do with dopamine. And a lot of physical illnesses, think of Parkinson's, Alzheimer's is indirectly related, Huntington's chorea, Tourette's, restless legs, stuttering, all of these things are dopamine related. And, we have to put that together. We also know that any chemical, like a stimulant, that that surges dopamine, like amphetamine, or the medications we use to treat ADHD, which we have to be very cautious with. Any medication that can surge dopamine can lead to psychosis, schizophrenic types of thought. So we know that dopamine is a key. The dopamine theory of mental illness has been around for 50 years or so or more. It's the central theory, and we still haven't come up with anything better because it's so central to what's going on. So for most of us, we're able to suppress dopamine in those tracks completely adequately, 80% of us, and that's it. But for the 20% who have mental illness, there's a slippage, there's a desuppression, and like I say, the big kahuna of schizophrenia, there's a massive surge of dopamine when they break down, which leads them back to primitive thinking, the type of thinking we had prior to language, the type of thinking that, cavemen had. And it's also the type of thinking that people have when they use psychedelics, that we all have when we're asleep. We have that same kind of primitive thinking, and that children have. They don't children don't think with the same rules that adults do. They have more primitive thinking. And gradually they learn by suppressing dopamine to advance to, adult reasoning, rational thought, the reality principle. So all of this is interconnected, and we have to look at that if we really want to understand a mental illness, which is why I have said that psychiatry is sort of in the dark ages right now. And I'm trying to lift it up a bit with this theory.
Right. So, see, this is important because, I think I may be typical of sort of a superficial lay understanding of it. Because previously when I thought about dopamine, you think about, well, the release of dopamine is a pleasurable thing, right? That you get like when you get a runner's high or whatever. But in excessive amounts, as you point out, that's where the downside really comes in. So when I first was looking at them, well, why would you suppress dopamine? But now I understand what you're saying about it.
The
And
dopamine has many functions,
mm,
and it is a reward chemical.
right.
Evolution made use of dopamine because evolution only rules on mutations. It can't rule on your day-to-day behavior. So evolution found a chemical that rewards, naturally selective behaviors like procreation,
Mhm.
finding food, defending yourself against a predator. You get a zets of dopamine as a Pavlovian reward. But there are other ways in which we use dopamine in the brain, and those are the ones that I'm focusing on with this theory.
So the treatment so far, as I understand it, has been from a medical point of view, medications has been, a sort of a cocktail of suppressants. Is that correct? I mean, that's what we've used so far.
Every medication we use for mental illness blocks dopamine either directly or indirectly. Now, if you look at the antipsychotic medications that are specifically for schizophrenia, they
Hmm.
go into your brain, and there's a receptor. Dopamine is a chemical that one nerve cell releases, and it goes across the synapse, and it gets hooked up to a receptor where it does what it's going to do, which is stimulate the next neuron. We give chemicals that fit right into that receptor and block it, so that this huge surge of dopamine is now dampened down because it can't get through to that receptor. Now, the same type of thing happens with antidepressants, but only indirectly, because what antidepressants do is stimulate something called an autoreceptor, and that autoreceptor dampens down dopamine. So every single mental illness we have has something to do with the desuppression of dopamine. And we have
Hmm.
to look at that. And of course, those other physical illnesses that I just mentioned.
Hmm.
Dopamine and another neurotransmitter, acetylcholine, are sisters. So if one goes up, the other goes down. So what we're trying to do with schizophrenia is dampen down dopamine. So if you surge acetylcholine, dopamine's going to recede. And that's what this medicine is doing. And it is new. It's a new approach, but it's doing the same thing ultimately to decrease the effect of dopamine. And we'll see. It's a little too early to tell, but I've heard good things about it. Time will tell how effective it is and how, what kind of side effects we're going to see. I do think some patients get nausea from it and things, but they've combined two medications to try to counteract the effect of a surge of acetylcholine. They've also put in an anti-acetylcholine medicine to work outside the brain. So it's
Hmm.
interesting, it's different, but the ultimate effect is the same, but it comes at it from a very different direction.
Is this it's available now for patients?
Yeah, it started to be available a few months ago, I believe.
Okay, all right. Okay, well, we have a lot more to talk about, but we are going to take a short break, folks. And when we come back, though, we'll be talking much more about mental health issues and mental illness, not only schizophrenia, but related illnesses. So don't go anywhere. We will be back with much more with Dr. Stephen Lesk.
Are you caring for an aging loved one? It can feel overwhelming, but you don't have to do it alone. Ron's book, The Caregiving Navigator, is a step by step guide designed to help you plan, prepare, and provide compassionate care with confidence. From organizing family conversations to navigating long term care and finding support for yourself, the caregiver, it's all here. Find the Caregiving Navigator now on Amazon and take the first step toward peace of mind.
Welcome back, folks. We're talking today with Dr. Stephen Lesk about mental illness. He is the author of the recent new book, Footprints of Schizophrenia, The Evolutionary Roots of Mental Illness. Now, before we get dive back into his work and his book, I want to just let you know that if you tell your friends and colleagues if they missed this show today, live show, don't worry, they can find replays of it on Bold Brave TV's YouTube channel. And just click on my 45 Forward playlist, and they can also find audio replays on major streaming platforms like Spotify and Apple. So, with that, let's continue with Dr. Lesk. Now, tell me, I know you've dealt with, people, patients. So, what is life like today for a person with schizophrenia?
Like I said, it's a very baffling thing because they don't understand that their thinking has changed. All they see is that other people are treating them differently. Now, again, their functioning tends to go down because they're not thinking in adult terms anymore. They're thinking in kind of a primitive way, what I call the primitive organization. So they're not able to negotiate a complex civilization that we're in. and they often end up in a group home, where they're given their meals, and they may hold a kind of menial job, or they may not work at all. They often don't marry. They often don't have kids. Their what we call fecundity ratio is much lower than the average person, and that's
Mhm.
something that has to be explained because Darwin said that any mutation that reduces your reproductive rate and your ability to function will quickly go extinct. And that's exactly what schizophrenics have: lower reproductive rate and lower functioning. It's
Mhm.
not going extinct. And why is that? Because it is not a genetic illness. It is an evolutionary glitch that we're going to have to work through over the next 10, 20,000 years. That's very different. And we've misplaced our focus on genetics. Genetics is like the engine light in your car. If the engine light comes on, you don't go to the mechanic and say, "Can you fix my engine light?" You go there and you say, "Something wrong with my engine." That's what genetics are. They show vulnerability to an illness. Yes, you may have a high vulnerability or a low. That doesn't mean you're going to get the illness or you're not, because people with low vulnerability can get schizophrenia and people with high. Plus, it's not just genetics. There are things in the environment that increase your risk of schizophrenia. Growing up in an urban area increases your risk. Being born in winter months increases your risk. Having a father who's elderly increases your risk. Having abusive parents, head injuries, all these things can increase risk, and genetics. But that's not the illness. The illness is something else. It's a return to a more primitive thinking because dopamine has resurged. So this is a very tough life for people to live, and they often require a lot of support, and hopefully they have a family that supports them. But as I
Mhm.
said before, there are some higher functioning schizophrenics. A book by a woman named Ellen Sachs called The Center Cannot Hold. She's a lawyer. She went to
Mhm.
Oxford. She went to Yale, all the time having psychotic breaks, being put on medications, going off medications because she insisted she wasn't schizophrenic. And
Mhm.
that's very typical of schizophrenics. They don't know they have an illness and they don't like the medication, so they go off. And it's very frustrating for their caregivers and parents. But anyway, she did the same thing, but she got through law school and she became a lawyer, mental health advocate lawyer. I'm not sure if
Mhm.
she's still practicing, but and there are many very high functioning. Look at Jonathan Nash from A Beautiful Mind, that movie, which is
Right.
very pretty accurate portrayal of schizophrenia. He won a Nobel Prize. I mean, Weijin Wang wrote a book called The Collected Schizophrenias that was on the bestseller list. So there are many high functioning ones, but on average, anyone who gets a diagnosis of schizophrenia is going to suffer a decline in their functioning and life trajectory. And their mortality is they live less long than the average.
So how would you shift and focus on I know that, part of your approach was that, you just got frustrated with the sort of the catchphrases and the generalities and, of a lot of your colleagues. So how would you shift the focus of work on schizophrenia? I mean, you'd say that this is something that's gonna disappear in, 20,000 years, but what do we do now? I guess you started to talk about some of it in terms of just support for those with schizophrenia.
Well, this is why I wrote the book, and this is what I'm doing with interviews. I'm trying to promulgate this theory. And like I said, I was at a psychiatric meeting presenting a poster on it. So I'm trying to push this theory forward so at least people will consider it. If they don't agree with it, that's fine. But I want it to be considered. Psychiatry is in the dark ages. Can you think of another specialty that has no blood test, no CAT scan, no x ray to make a diagnosis? All we can rely on is what the patient tells us. And
Mhm.
patients are not always in the best condition to relate what's going on with them. Like I said, a lot of them don't believe they have an illness, but others are telling them, you must see a psychiatrist. So if we don't understand the patients we're treating, and the patient doesn't understand that they have an illness, and we don't have a good understanding of the medications we're prescribing, this is a dark ages situation, and a lot of psychiatrists are not happy with where psychiatry is at, and I'm trying to offer a solution. If people could look at this, we might refocus our research efforts away from genetics genetics is not going to solve the problem. It's not a genetic illness. And we could start focusing on, how it is that dopamine desuppresses and what we can do to try to prevent it before it happens. Now, there
Mhm.
are studies on what we call ultra high risk for schizophrenia. And these are kids in their early teens who are showing potential signs that they might become schizophrenic in the future. And then the question is if we can identify them with great accuracy, we could justify medicating them prior to anything happening. But, first of all, the medications are not benign, they're
Mhm.
horrible. The best medication we have for schizophrenia is called clozapine. Clozapine can cause seizures, drooling, weight gain, bowel obstruction, and it can cause a whole bunch of other side effects. Neutropenia. When this medication was first used in Europe, they had to stop using it because people died from drop in their white blood counts. It was only brought here when we established this policy that they must get a blood test every week. And now they're terminating that requirement, in hopes that things will be okay. But anyway, our medications are not where they should be. They have
Mhm.
many too many side effects. We don't know which medication is going to work for which patient. So there's tremendous trial and error that goes on. They
Right.
take too long to work. Antidepressants take 6 to 12 weeks to work. And if they don't work, you're starting from scratch. So that's why they've developed other medications, add on medications to give with antidepressants called augmentation to try to get them to work without having to go through the whole thing again. But we're not where we should be in psychiatry. And I'm not here to put down psychiatry. I love my profession. I've helped a lot of people, but we're not where we should be. And I think it's because we refuse to look at evolution and what role that plays in all of that we're seeing. You can put a bicycle together, but if you leave the pedals off, it may look good. It's not going to get you anywhere. You've got to have the whole machinery to get somewhere. And this is a piece of the puzzle that is missing. That's what I'm doing. I'm trying to get the word out there so that people will look at this. And I would like everyone with any kind of mental illness to go to their provider and ask them, what is the role of evolution in mental illness? And if they shrug, give them this book or you read
Mhm.
it and tell them about it. We
Mhm.
have to get the word out. And there's so much resistance. It's sad. It makes me sad to see how much
Mhm.
resistance there is to this.
Yeah. Well, certainly, I think our society looks at quick fixes, and medications are quick fixes, and they make money, and they work to an extent, and people, I've got issues in my family, and it's precisely what you said, which is, the frustration I have with just, the trial and error. And also, that you're right. We we it's hard for us to treat it as an integrative whole focused on something like dopamine. So we just sort of, well, this will deal with bipolar, this will deal with, anxiety disorders, this will deal with depression without thinking. And then it's just like it becomes this cocktail, and we don't know what the interrelationship effects are of these medications. So it becomes really a problem. And as you said, the person, with the disability doesn't want to take these. They're trying, and as you point out, this is part of the issue, and I get it. They don't want to think that they have a problem. They don't. There's denial, and they don't see it, and so you're battling with the patient a lot of times. But in looking at your approach, then, so you would then basically refocus the research on the role of dopamine and how, are there ways to deal with it? And I think understanding the function of it in a much clearer way, other than, the superficial notions we have of, the layman has, also, its reward, um, function.
Yeah, and when I was doing my residency, and I would listen to the attending psychiatrist explain to families, parents would come in and their kid had just been diagnosed schizophrenia, and they would say, "Well, what is schizophrenia?" And all I heard them say was, "Well, it's a chemical imbalance, or it's
Mhm.
genetics, or it's connectivity, or whatever," which means nothing. These are catchphrases. We have to have something deeper, which is why at some point in my career, I said to myself, someone has to come up with something deeper. And I started reading anthropology texts, reading Darwinian evolution, reading about language, and it started to come together and gel into a theory that made so much sense to me. And I wrote letters about it. I wrote papers, no interest whatsoever. And I realized I had to write a book for public consumption that will explain this theory. Then maybe more people will be exposed to it and they will demand from their providers, why aren't you looking at this? And that's what I'm trying to get at, to get patients to see this and bring it to their providers and demand that they look at it and consider it. That's all. If you want to
Mhm.
disagree, fine. I'm not, infallible, but let's take a look at this. We could be doing so much better. Psychiatrists help a lot of people, and I'm not putting down medications or psychiatry or anything else, but we have to do better than we're doing because there's so many, flaws. And psychiatrists are so kind of demoralized and desperate that we're trying to use psychedelics, which were used back in the 60s and 70s. They are not going to help people. They're going to harm a lot of people. They may help some, but we're so desperate for a pill, a magic pill, that we're going back to that. It's like the Mad Hatter. You know, that's not the way to go. If we weren't so desperate, we would be along a path of gradually getting better and better in what we're doing and understanding it. Once you understand an illness, you can work out ways of treating it and investigating it and studying it. But if you're just all over the map, it's genetics, it's this, it's that, well, of course, we're not going to be focused. And then you bring in the whole issue of drug use and alcohol use, which is rampant among this everyone, but
Mhm.
especially mentally ill who are desperate for some relief. That's throwing gas on the fire. We've got problems here, and I think this point of view will make a difference. That's why I'm doing this. It will make a difference.
Yeah, it's and going to be require a sort of a persistence of vision because in our environment today, I mean, I think we're just cutting research, and I'm not sure what's going on domestically. I don't. There seems to be no plan that's in place except to cut people and cut costs, and without an investment in these sorts of issues. Again, I think that I think that part of the greater message is that this is a pervasive issue. It's not, you know, and I deal with the space of dealing, helping people as they get older, which involves some, families and taking care of younger people as well as themselves as they get older. And, I still think there's persistent ageism. We think that this is some sort of siloed population. It's like, no, we're all going there. That's what we're all getting older. I find it
Yeah,
ironic that,
I'll
that,
agree.
yeah, that we're looking at the possible, insolvency of Social Security, which will happen roughly the same time as demographically we will officially be an older nation. There will be more people over 65 than under 18. We're not putting this together. Like we need to invest in these things. So yeah, and in terms of your book, I mean, we talked about your hopes for how your theory will be used, basically just to explore this issue and be, I think, just be open minded to it. I think that
Yeah.
it's
That,
difficult. It's innovative.
That's how science progresses. It's like evolution. There are mutations, and some aren't helpful, so they go extinct, and others are, and they persist. Same thing with science. It's based on hypothesis, and some hypotheses will prove to be true and very helpful, and others will go extinct. And that's the way it is. But if you block access to certain hypotheses from coming forward to be examined, you're eliminating a lot of potentially very useful issues and items, and there's no reason for it. There's a certain sense of kind of fear or prejudice or something about new ideas that is disheartening. They should be welcomed and examined, and some of them have to be discarded. But if we were at such a great place, in our profession, I'd say, okay, well, maybe we're not interested in hearing something new right now, but we're not. We need something like this. and I'm trying to bang the drum to get it in to where people are going to consider it more and at least have an idea that this may be playing a role. Because without it, it's just too big a piece of the puzzle.
We have to take another quick break, Doctor. When we come back, though, folks, we're going to have one more wrap-up session with Dr. Lesk. So don't go anywhere. We still have a lot more to wrap up and to give you information about where you can get his book and find out more about his work. So we are going to take a quick break. We'll be talking much more in our last segment.
Do you like what you're hearing? Well, we've got plenty more where that came from. Head over to 45forward.org, where you'll find a full archive of over 200 episodes of the 45 Forward podcast, all hosted by Ron. Each week, Ron talks with fascinating guests, experts, advocates, and everyday folks, sharing insights and stories to help you live a better, fuller life in your second half. We cover everything from health and caregiving to careers, relationships, and finding purpose, whatever helps you move forward with clarity and confidence. That's 45forward.org. Check it out and keep moving forward. 45 Forward.
Welcome back, folks. This is Ron Roel, 45 Forward, back with our final segment with Dr. Stephen Lesk, talking about mental illness, schizophrenia in particular, but a much broader perspective that involves schizophrenia. So before the break, we were talking about evolution, and during the break, I was talking to Dr. Lesk about getting the book out there, getting a discussion about these ideas, and also then he's got some other books coming down, which also touch on the idea of evolution. So talk about, you've got one, actually two more books. So talk about these books and what your premises are.
Well, the most recent book is called The Predator Factor. Now, if you think about, the life that we evolved in, we lived in a jungle. We had no cars, no grocery stores, nothing. We woke up every day and we went out, risking our lives to try to find food somewhere. Half the time we were attacked by wild hyenas, lions, and things. If we broke a leg, we were basically dead because there was no treatment for it. If we got an infection. So this was an intense situation that I call the crucible of evolution, where if there's a mutation and it's helpful, it's quickly adopted. And if it's harmful, it quickly goes extinct under this intense heat, the crucible of evolution. But now we form civilizations, which are a product also of language. And those civilizations have neutralized 90% of these predators. And so we're also seeing an increase in longevity recently. Just 100 years ago, many women did not live to menopause at all. The average longevity in the 1800s was 40. So,
Right.
It's a very recent phenomenon that we're living into the 70s, 80s, and beyond. But this issue that, the intensity of the crucible of evolution has died down so much that we're seeing all these social phenomenon, like increase in youth depression, anxiety, and suicide, low birth rates. People are choosing not to have children. That was not a decision that people made when I was growing up. It was like, oh, I'm going to have a family. I'm going to have kids. I know what gender I am. I didn't have to think about that. People are withdrawing from these social roles, and they're having, gender boundary issues that we never saw before. So all of this relates back to what I call the luffing of evolution, because the heat intensity of it is so much less now, and we have so much time that we live. I mean, if you knew your lifespan was 30, which is maybe the average lifespan of a caveman, things are a lot more intense than if you know you're going to live to 100. So that's one issue that's, my new book called The Predator Factor, that I'm looking for an agent. Then I also wrote a book called Entropy's Desire, because while I was figuring out this theory about schizophrenia and mental illness, it became clear to me that schizophrenics, like I said, regress to a more primitive simplistic type of thinking, and that the second law of thermodynamics is involved with this because what is the second law of thermodynamics? Entropy. It craves disorder, chaos, low energy instead of order and repetition and clear boundaries. It seeks disorder, and that's exactly what happens to a schizophrenic when they break down. Their thinking goes from adult, ordered, rational thinking to primitive, disordered thinking, and that is partially because it gratifies entropy, what I call entropy's desire, which is the name of the book. And of course, all physical illnesses are the same. As we age, entropy causes our proteins to break down faster than we can repair them. And gradually it catches up with all of us, and entropy wins. I mean, we all don't live forever. And this is all part of entropy. And then the other part of it is that entropy has been inserted into all animals as what Freud called the death instinct. Every animal has to learn to hunt down and kill and eat other animals. And
Right.
that serves the purpose of entropy, which seeks to transform everything back to the inorganic, everything living back to the unliving. So we have adopted some of that ourselves. And of course, civilization demands that we don't do that. But still, there have been wars, genocides, holocausts, crusades forever when this impulse, this death instinct comes out anyway, despite the fact that we have civilizations that are supposed to prevent that. So all of these things are interrelated, and I don't want to throw too much out at once, but
Yeah.
that,
Well, go ahead.
so much that we need to look at.
Yeah. Well, I think that, but it does make sense. I mean, certainly if you look at, what nature does to habitats, it's basically, if you have a lawn, curated lawn, and you let it go, it resorts to entropy, and
Yeah.
it's weeds and the different plants, and it fills in spaces, and it's the prim and proper lawns is not the nature of things,
Back to a disordered state. And if you think of all the other planets, they're all balls of dust or gas. Entropy has turned every other planet into a dust bowl of lifeless, dirt and rocks. We're the only planet so far that we know that has life. And I said in my book on entropy that the purpose of life is to defy entropy. But entropy has won on every other planet. And so far, we haven't found any that have anything like what Earth has. So, what entropy is trying to do to us is to turn us into Mars or the moon and all of dust. And it may succeed at some point.
Now, so how do you see your own life in terms of your evolution of your thinking? Is this a surprising thing that you've come up with? I bet you didn't expect this, when you set out in your career.
I didn't expect it, and I knew that something more had to be there because you can't just toss out catchphrases. If you go to an orthopedist and say, I have a pain in my knee, he does an MRI, an X-ray, and he says, here's why you have a pain, and here's what we can do about it. Psychiatry doesn't have that. We're lost. Oh, it's a chemical imbalance. It's just, we need to be more specific. So I broadened my horizons and started reading things that I thought must have something to do with what we're seeing. And it did. There's some luck involved, but it did. I'm kind of a nerd. I spent my whole life reading articles and staying with the literature, and I still review psychiatric articles for a continuing medical education company. But I came across this theory and I started to work with it. It's like a car. You kick the tires, but you have to sit in it and drive it around a little and then see how it feels. And I think if psychiatrists will do that, they'll see how comfortable it is and how much sense it makes. You get in the car and suddenly, yeah, this thing feels good. That's what people have to do. But if no one's heard of it, they're not going to do it. You got
Right.
to go to the used car lot and drive it around.
It does seem like it's a challenge in our current environment
It
because
is.
even our whole funding structure of research is geared toward certain outcomes, and I have friends and family who have been involved in research, scientific research, medical research, and it's tough. You spend half your time trying to get grants and try to fit into the philosophy of the granting institutions. Um, So, and I think that I think we are focused on, very specific disease. I mean, we're focused on cancer research. Now there's a big, push on Alzheimer's and dementia research. That's fine. I'm not, arguing against that. But I think in the whole area of mental health, I think I just sense that there's a reluctance of, from an institutional perspective, in terms of, government institutions, agencies, to understand the importance of it and how to fund this area.
Yeah, there's a blindness, especially in regard to the issue of evolution. I mean, Alzheimer's, there's an intense, research on this, but think about it. It's related to dopamine. Acetylcholine and dopamine are sisters. So why? Why are we seeing that? If you don't look back into our evolutionary past, you'll have no idea. But if you do, you will have an idea. And that's important. If you're a researcher in Alzheimer's, you want to understand why acetylcholine is diminishing, just like in Parkinson's. Why is dopamine dropping and these dopamine cells are dying? Because we're using dopamine in a totally different way now. And if you don't know that, you're in the dark. You're scratching around trying to find an answer. And I worry about all specialties and science. If we're not open to new ideas, we're going to block and discard a lot of things that could really help mankind. Why should we be so close-minded? Because it's easier to stick with the tried and true. It's easier, but it doesn't get you anywhere.
Yeah, I think that, one of my catchphrases is that people resist change, and they're more receptive to change when the pain of not changing overcomes the fear of change.
Psychiatry's at that point. Yeah.
Yeah. Well, thank you for a really enlightening show, Dr. Lesk. I've learned a lot. I hope our audience has. I hope people recognize the importance of it, especially, as I have a 45 Forward audience, that they are in a position to really take a step in this direction, really looking at it.
Get the book on Amazon and Barnes and Noble. And my website, StephenLeskMD.com. The book
Right.
is Footprints of Schizophrenia, The Evolutionary Roots of Mental Illness. Take a look at it. And I have presence on TikTok under the theme published author. And on X, I have YouTube videos too. So they're all ways to kind of get a sense of what this is about.
Right.
It's important. It's
Yeah.
really important.
And so you can get a lot of this on your website, right?
Yeah.
StephenLesk.com, right?
StephenLeskMD.com.
MD.com. Good. Okay. Very good. Okay. Okay. Well, this has been Ron Roel, host of 45 Forward on Bold Brave TV. Thank you for spending this hour with me and learning a lot from Dr. Lesk. If you have comments for me, you can send suggestions for my show. Please email me at ron.roel@gmail.com. I want to offer my thanks to Alex, my engineer, who helps me through every show. And I wanted to say, in terms of the next week, be sure to join me next Wednesday at 7 p.m. Eastern Time. And I'll be talking with Diana Yin. She's the CEO and co-founder of Better Age, which is a public benefit corporation committed to improving the health and well-being of older adults and narrowing the equity gap through their efforts. So until then, folks, keep moving forward, 45 Forward.